we are now going to go to Collins Jacobs. Collins, are you with us? Are you there?
Yes, I am. Good afternoon. Can you hear me?
Yes. Oh, sorry. I'm looking at you twice. I think we've got two sort of logged in as Collins Jacobs here, so it's fine. As long as I have the actual Collins Jacobs, that's absolutely fine. Thank you so much for joining us today. So Collins Jacobs is a creative generalist specializing in business product development and management, an atypical thinker who consistently generates innovative solutions to complex problems, and a prolific management strategist recognized for diverse experiences across a variety of industries. So I see that you are a business professional with over 12 years of experience of profound exposure in strategic planning, product development, business development, and process optimization, client management, communications, journalism, gained from across working in private sector, public, regional, and international platforms. So you have a wealth of experience, I can see. And your recent work experience spans working in Nigeria, South Africa, Malawi, and Angola. As a business development lead at Wella Health, which is where you are, I believe, head of business development, you are responsible for growing customer acquisition, driving insurance adoption through strategic partnerships and business approach. I hope I have that right, Collins. If I've missed anything or if you'd like to add anything, please feel free to do so. Otherwise, the floor is yours.
All right, thank you very much. You have said everything correctly. Hello to everyone who is on this webinar, to other panelists and participants. It was quite, I think it's a huge pleasure, let's start with that, to have me be here, have me to talk about the work that we do at Wella Health. If you look at health-seeking behavior in Africa, you'd understand that significantly more than 70% of Nigerians especially would spend out of pocket for their healthcare needs. And this would usually drive people to poverty. And when you look at the number of persons who can access health insurance, we have like a 3% of the entire population doing that. And that 3% comes from rather mandatory health insurance that is provided by employers. So you find out that a significant proportion of the population do not have access to quality healthcare that doesn't cost so much. And the informal sector would be large in that percentage. So in examining this, Wella Health about 5 years ago, whilst creating a solution that helps pharmacies and healthcare delivery institutions manage patients' profile, discovered that a number of cases or reports or claims in that regard, treatment when it comes to healthcare needs centered around malaria and common illnesses, right? So together, our co-founders thought that, okay, why not we have a small pocket of plans that speaks specifically to the health needs of Nigerians and Africans in general, when you consider that malaria is endemic in this part of the world, and break down the cost so that the people can afford it. Yes, there is affordability on one side, and there is access on the other side of things. So in terms of affordability, we're able to create a plan that today costs about $1, right? For people to be able to access care for malaria, common illnesses like cold, cough, and all of those domestic illnesses. But then, best they can afford, so how do they then access? We looked at the healthcare delivery spectrum. We find a set of people known as community pharmacists. We understand that they are usually the sort of call, depending on where you're looking at it from, at the community level when people need to obtain medical care. Before now, we'll refer to them as chemists or talk shops where people will buy medications, and regulations have really helped to up the standard at that level. So we went into partnership with the Association of Community Pharmacists in Nigeria to plug in pharmacies, and today we have 1,800 of them who are able to deliver access to this healthcare. So what that means is that when somebody is down with malaria, common illnesses, instead of traveling far to hospitals due to infrastructure deficits, they could easily connect with us, and we would connect them to a pharmacy near them, and they will be able to access tests, importantly, and treatment for their malaria and other plants. But again, in doing this, remember that our goal at Wella Health is to make affordable health care possible for everyone in Africa, with our focus on Nigeria at the moment. It's the issue of purchasing power, if that's the right word to use. It's the issue of people now being able to reach into their pockets and even buy these health plans, right? So we, over time, looked at what can we do to extend the coverage and ensure that those who would struggle with being able to afford that $1 or being able to spend that $1 for their health plans can actually still also have cover. So we designed what we've called Partnership for Good, and the goal is towards universal health care for all Nigerians. So I had said this earlier about the statistics, so I'm going to move past that slide. So what Partnership for Good seeks to do is collaborate with corporate entities within the private and public sector with a goal to providing 1 million Nigerians with basic health coverage over the next 1 year. We started this project in January of 2022, and we have been able to drive this partnership significantly, because when you look at, like I said earlier, the type of plans that we have, they are about making sure that they speak specifically to the health needs of Nigerians. Have cash back, so that when you have issues that escalate beyond malaria or typhoid and you need to get to the hospital, we also provide a cashback system that allows for these persons to be able to access quality medical care. So as part of being able to deliver this affordability, one of the other challenges we saw was tangibility, right? So we were able to come up with a malaria health card that puts tangibility into the hands of these users, so that we leverage technology to do so. So we designed a card that allows people to be able to sign up to our plans via a USSD code, which can be accessible via a feature phone or even a smartphone. So when you consider technology and internet penetration, you see that this allows us to be able to further deliver the access part of it. So with this malaria health card, we're able to now create a plan that allows corporates to be able to spend towards providing healthcare as a means of corporate social responsibility towards the communities that they serve or communities that they have vested interest in. So what we do is basically enter into partnership arrangement with these corporate entities, would share with them the plans that we have. They would indicate the communities that they want to reach and the quantity of the plans that they want to share and for what duration. So we have monthly plans, we have quarterly plans, we have 6 monthly plans, and we have annual plans, right? So when they indicate any of the plans that they want and in the quantity that they want and duration, we're able to plan and organize around the communities, go down to the communities, create the awareness process, talk to them about why we are there, and be able to activate their plans for them and connect them to this healthcare service. Over the course of the last 7 months since we started, we have been able to provide coverage for 5,000 plus Nigerians through this partnership with a number of corporate organizations in the FinTech sector and in the power energy sector who have partnered with us. We are still in continuous talks with other corporate and individuals as well, who constantly express interest to also key into this drive to provide 1 million Nigerians with affordable healthcare. The role that we play is to provide the technology, and what we also do with such partnership is to take out a significant part of the cost so that more people can enjoy this access when we have a corporate entity buying in. Like I said, our goal is to reach 1 million Nigerians. We want to do so by December 12, 2022, which is the date that the World Health Organization has set for the commemoration of universal health coverage across the world. And we're hoping that we're able to consolidate on the gains we had in this last 7 months and be able to continue to expand such partnerships, ensuring that more Nigerians and indeed Africans can get access to quality healthcare that is affordable and that doesn't necessarily have to come from out of their pockets, right? And we are hoping that the impacts would create a type of conversation around with development partners, with government agencies, private entities, and the community at large to see why it is important that people have access to healthcare. And when we get feedback from those that have benefited from our healthcare plans and they share how much value the healthcare plans have meant to them, it further helps us to appreciate the work that we do and help our partners to appreciate the work that we do and be willing to commit to more work to making sure that we are able to reach the goal. So for us, we are about, again, affordable healthcare. We'll continue to do that, whether it's through partnership for good or through creating simplistic plans that are cost effective, that those that can afford it so that they'll continue to enjoy better health. Thank you for listening. Continue to enjoy the web.
Thank you so much, Collins. That was brilliant. And I have several comments and questions, which I think we'll probably come back to later on, because one of the key points that we keep coming back to, or I keep coming back to, is sort of roadblocks and what the government is or isn't doing in order to be able to allow us execute these services. So if you are able to stick around, we'll be having a very sort of I think quick-fire Q&A shortly, if that's okay. But thank you so much. That was brilliant, and thank you for everything that you are doing and what you are actually delivering. You know, it's certainly paving the way for others to follow suit. So thank you so much, Collins, for that. Okay,
Thank you too.
Lovely.